Polycystic Ovary Syndrome, or PCOS, is a hormonal disorder that affects women of reproductive age. It is characterized by an imbalance of hormones. This imbalance can lead to a variety of symptoms. Many women with PCOS have multiple small cysts on their ovaries. These cysts are actually follicles that contain immature eggs. However, some women with PCOS do not have cysts on their ovaries. PCOS is a complex condition that can affect a woman's menstrual cycle, fertility, hair growth, skin, and overall health. It is important to note that PCOS is a spectrum disorder. This means that the severity and combination of symptoms can vary greatly from woman to woman. Some women may only experience mild symptoms. Others may have more severe symptoms that significantly impact their quality of life. It is crucial for women to understand PCOS and its implications. Early diagnosis and management can help prevent long-term health problems and improve overall well-being. The exact causes of PCOS are still not fully understood. However, researchers believe that a combination of genetic and environmental factors plays a role. Genetics, PCOS, often runs in families, suggesting a strong genetic link. If your mother, sister, or other close female relatives have PCOS, you may be at a higher risk. Insulin resistance. Many women with PCOS have insulin resistance. Insulin is a hormone that helps your body use glucose for energy. Insulin resistance occurs when your cells don't respond properly to insulin. This can lead to high levels of insulin and androgens, or male hormones, in the blood. Both of these can contribute to the development of PCOS. Inflammation. Recent research suggests that chronic low-grade inflammation may be a contributing factor to PCOS. Inflammation can disrupt hormone balance and contribute to insulin resistance. Environmental factors. Exposure to certain environmental toxins, such as BPA found in some plastics, has been linked to an increased risk of PCOS. PCOS can manifest in a variety of ways, and symptoms can vary from woman to woman. Some of the most common signs and symptoms include irregular periods. This is one of the most common signs of PCOS. Women with PCOS may experience infrequent periods, prolonged periods, or completely missed periods. Excess androgens, high levels of male hormones, or androgens, can lead to symptoms like acne, hirsutism, which is excess hair growth on the face, chest, or back, and male pattern baldness. Weight gain. Many women with PCOS struggle with weight gain and find it difficult to lose weight, often due to insulin resistance. Infertility. PCOS is a leading cause of infertility in women. The hormonal imbalances associated with PCOS can interfere with ovulation, making it difficult to get pregnant. Other symptoms. Other possible signs and symptoms of PCOS include fatigue, mood swings, sleep problems, skin tags, and darkening of the skin in certain areas. If left unmanaged, PCOS can increase the risk of developing several health problems later in life. Type 2 diabetes. Insulin resistance, a hallmark of PCOS, significantly increases the risk of developing type 2 diabetes. Cardiovascular disease. Women with PCOS are at a higher risk of developing heart disease, stroke, and high blood pressure. Sleep apnea. This sleep disorder, characterized by pauses in breathing during sleep, is more common in women with PCOS, particularly those who are overweight. Endometrial cancer. Women with PCOS who have infrequent periods may be at an increased risk of endometrial cancer, a type of uterine cancer. Mental health issues. PCOS and its associated symptoms can take a toll on mental health. Women with PCOS may be more likely to experience anxiety, depression, and body image issues. Diagnosing PCOS can be tricky because it presents differently in each woman. There is no single test to diagnose PCOS. Doctors use a combination of your medical history, a physical exam, and test results to make a diagnosis. Medical history. Your doctor will ask about your menstrual cycle, symptoms, and family history of PCOS or other hormonal disorders. Physical exam. This will likely include checking your weight, body mass index, and blood pressure. Your doctor may also examine your skin for acne, hirsutism, or other signs of PCOS. Pelvic exam. Your doctor might perform a pelvic exam to check for any abnormalities in your reproductive organs. Blood tests. These tests can check your hormone levels, including androgens, insulin, and other hormones related to PCOS. Ultrasound. An ultrasound can be used to visualize your ovaries and check for cysts, the Rotterdam criteria. Doctors often use the Rotterdam criteria to diagnose PCOS. You must have at least 2 of the following 3 criteria to be diagnosed with PCOS. 1. Irregular periods. 2. Signs of excess androgens, either clinical or biochemical. And 3. Polycystic ovaries on ultrasound. Managing PCOS involves a multifaceted approach, as there is no cure for PCOS. However, it can be effectively managed with lifestyle modifications, medications, and emotional support. The goal of treatment is to manage symptoms, reduce long-term health risks, and improve quality of life. When it comes to lifestyle changes, weight management is key. Even a small amount of weight loss, like 5 to 10%, can significantly improve PCOS symptoms, especially insulin resistance. A healthy diet is also important. Focus on a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Limit processed foods, sugary drinks, and unhealthy fats. Regular exercise is another crucial component. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. And don't forget stress management. Engage in stress-reducing practices like yoga, meditation, deep breathing exercises, or spending time in nature. Medications can also play a role in managing PCOS. Birth control pills can help regulate your menstrual cycle, reduce androgens, and improve acne. Metformin is another option. It improves insulin sensitivity and can help with weight loss, regulate periods, and lower androgen levels. Your doctor may also prescribe other medications to address specific symptoms like hirsutism, acne, or infertility. Mental health support is equally important. Therapy can provide support and coping strategies for managing the emotional challenges of PCOS, such as body image issues, anxiety, and depression. Connecting with other women through support groups can also provide a sense of community and shared understanding. Let's address some common misconceptions about PCOS. One myth is that you can't get pregnant if you have PCOS. This is a common misconception. While PCOS is a leading cause of infertility, many women with PCOS can get pregnant, especially with lifestyle modifications and medical treatment. Another myth is that PCOS is a rare condition. In fact, PCOS is very common, affecting an estimated 1 in 10 women of reproductive age worldwide. There's also a misconception that PCOS is caused by being overweight. While weight gain is a common symptom of PCOS, it is not the cause. PCOS is a hormonal disorder that can lead to weight gain and make it harder to lose weight. PCOS can have a significant impact on a woman's mental and emotional well-being. The visible symptoms, such as acne, hirsutism, and weight gain, can lead to body image issues, low self-esteem, and social anxiety. The hormonal imbalances associated with PCOS can also contribute to mood swings, anxiety, and depression. It is crucial to address the mental health aspects of PCOS alongside the physical symptoms. Seeking support from a therapist or counselor who specializes in PCOS or hormonal health can provide valuable coping mechanisms and emotional support. Joining a support group for women with PCOS can also foster a sense of community and understanding. PCOS is a lifelong condition, but early diagnosis and proactive management are crucial for preventing long-term health complications and living a full, healthy life. If you suspect you might have PCOS, don't hesitate to talk to your doctor. By understanding your body, adopting healthy habits, and seeking appropriate medical care, you can take control of your health and minimize the impact of PCOS on your life. Remember, you are not alone, and there is support available to help you thrive.